Hi there. My name is Benno Thompson. I'm a clinical application specialist with Hamilton Medical. And today I'll be talking about usage and demonstration of the Hamilton G5. I'm going to start in the back of the vent. So starting down here, we have our RS-232 ports, which are good for hooking up to nurse monitor and nurse call buttons. Up here, we have our air inlet, high pressure air inlet, high pressure O2 inlet. Over here we have our high pressure heliox inlet, on off button. And then down here we have our gas reservoir. So if the patient has an inspiratory flow demand that is greater than what's in the circuit, they can pull off of that. Moving around to the side, compact flash drive, and a USB drive for taking screenshots. We'll get into that later as well. Also, you have a DVI port for hooking your ventilator up to give presentations on a large screen or projector. Over here in the front, we have our auxiliary port for esophageal monitoring, pneumatic nebulizer port. Over here we have our flow sensor ports. They're color-coded, clear to silver, and then blue to blue. Over here we have our IntelliCuff port. I'll get into IntelliCuff in a little bit. Down here we have our expiratory valve. It unscrews and unscrews on with a half turn. This is disposable, but we also make a reusable version as well. Over here we have our Aerogen cable connect for carbon dioxide monitoring, and our connection for an SpO2 monitoring, if your facility does that. I'm going to talk to you a little bit about moving the screen so that you can orient it to your liking. The screen does detach if you would like to put it somewhere else. Going around to the back. To move the screen from side to side, simply push this lever down and the screen turns. To tilt the screen, you would push in this lever and then you can move all the way back. When it starts up, this is the first screen you'll see. This will be your standby screen. The first thing you need to do before placing on a patient is the pre-op check. It's down here. So press pre-op check. So tightness, you do first. To do the tightness test, you press tightness test. Everything it wants you to do is going to tell you right here, tighten patient system for instance. So you just plug your circuit up. And it takes about 20 to 30 seconds to perform the tightness check. Patient system is tight. You also get a green check mark and a date and time in which the test was passed. This will carry over even if you shut the vent off and turn it back on. All of this data on when each pre-use check was completed will populate again. Flow sensor would be next. For the flow sensor, every flow sensor comes with this piece. So press flow sensor, and again, you will be prompted up here to turn the flow sensor. So you would flip it around like this. And the flow sensor test will take about 20 or 30 seconds on this orientation. And then on the other orientation, when you flip it back around, it'll take another 20 or 30 seconds. The O2 cell, we only recommend calibrating when prompted to by the machine. Up here you'll see turn flow sensor again. So turn it back around. Every time you get prompted to do something by the ventilator, it will give you 15 seconds to do so, or it will cancel the calibration and mark it as a fail. Once your flow sensor and your tightness test are complete, you are ready to place the ventilator on a patient. Flow sensor calibrated okay. We have a green check mark. You are good to go. This piece comes with a clip, so you can clip it onto your flow sensor tubing so that you will have it for future needs of flow sensor calibration. To activate your CO2 sensor and calibrate it, you will need a CO2 sensor wire and your airway adapter. So what you do is you just unravel it, plug it in down here into your CO2 port, go up to sensors on off, activate your CO2 sensor, back to test and calibration. To calibrate your CO2 sensor, you take your airway adapter, place it into the port, hit CO2 sensor calibration. We'll give you a picture telling you to place your adapter in and have it out of the circuit into room air. You hit OK, and it takes about 20 seconds to calibrate. And when it does, it will tell you the CO2 sensor will be completely calibrated. CO2 sensor calibrated, OK. Now you're ready to place the CO2 on the patient. Before I get into the actual usage and demonstration of the G5, I would first like to talk about the proximal flow sensor. The proximal flow sensor on Hamilton products measures not only volume, but pressure and flow, making it a unique flow sensor in the ventilation world. Because of this, we're able to get advanced data that you would normally need advanced maneuvers to get, such as static compliance, breath by breath. There is a purge flow running through this flow sensor, and it will keep out your secretions, your nebulizer mist, and your rain out. But only if it is kept upright with the tubing pointed to the ceiling. If it is pointed down and there is a pool of secretions or rain out, creating a snorkel situation, this purge flow will not be effective and your flow sensor will not be able to get the appropriate data. So please reinforce to your staff and your nurses to please keep and be cognizant that your flow sensor tubing is pointed upright. Now I'm going to get into the actual application and usage of the Hamilton G5 on patients. First thing you'll have to do is punch in your gender and height, which will give you your ideal body weight. Second of all, you'll have to put in your patient population, adult, pediatric, or neonatal. We do cover all patient modalities. Going up here to choose the mode, in the mode section, all of our modes are categorized. Pressure targeted are on the left, volume targeted are on the right. Starting up in the top of the pressure column, we have pressure control mandatory ventilation, which is your basic pressure mode. Pressure SIMV, duopap, which is a form of bilevel that is non-PEEP compensated. APRV, which is a PEEP compensated form of APRV, airway pressure release ventilation. Spontaneous is a spontaneous mode, which is pressure targeted. So it's a pressure support type of ventilation. NIV and NIV-ST are non-invasive ventilation. ST has a rate, NIV does not. Over here on the volume section, we have SCMV, which is your typical volume control mandatory ventilation mode. SIMV, which is volume SIMV. APV and APV-SIMV are variable flow volume targeted modes. VS, volume support, is another spontaneous mode. Instead of spontaneous, where spontaneous is targeted to a pressure, volume support targets a tidal volume, and your level of pressure support is variable depending on patient effort. ASV is adaptive support ventilation. That is Hamilton's unique closed loop ventilation mode. Finally, we have the option to do high flow oxygen therapy. It's currently grayed out on here because the option isn't activated on this particular ventilator. Once you have chosen your mode, you would hit continue if you're choosing a new mode. If not, you would go into your control panel. Up here, you'll have all of your general ventilator settings. I time, rate, target volume, since we are in adaptive pressure ventilation. P ramp, which is akin to rise time. Flow trigger, PEEP, and FiO2. Also over here, you'll find a calculator window, which will change and give you calculated values such as rate, total cycle time, I time, E time, I to E ratio, and if you have the accurate ideal body weight plugged in, it will give you your tidal volume per kilogram of ideal body weight. If you notice, when I start to change the rate, it also changes all the values on here even before I've confirmed. Same thing with tidal volume. Once you begin to adjust it, you'll notice down here, your tidal volume is adjusted per ideal body weight. Once you have your settings plugged in, you would hit confirm. Whoops. By Xing out. And then when you're ready to place the patient on the ventilator, you would hit the start button. This is your initial screen when the ventilator starts up. All monitor parameters are on the left. All set parameters are on the right. Starting clockwise at the top and going around. In the patient section, if you did not have a chance to put in your ideal body weight, or if you had the wrong patient data, you can always go into the patient section and fix your height or gender and put that in accurately. Additions is where you'll find the option to do sigh breaths or tube resistance compensation. What this does is you would enter in the size of endotracheal or the size of airway you have, the level of compensation you want to give, and whether or not it's an endotracheal tube or a tracheostomy tube. And this will offer resistance support. Mode section, we already went over. Button over here, which looks like an elevator door close symbol, is a freeze screen button. So you would press it and then use your knob to scroll back to look at any data point that you would want to see on your waveforms. Yellow values are pressure, pink values are flow, and white values are time. To take it out of the freeze screen option, you just press the freeze screen button again, and it resumes into real time. Over here you have 4 settings. If you would like to see the rest of your settings, you can go back into the control panel. That's also where you'll find your calculator window. Alarms. This is where you'll find your alarm parameters section. The green floaters and the green numbers on each column indicates what the patient is actively doing at this moment, making it a little bit easier to set your alarm parameters around what the patient's doing. In the loudness section, you can adjust the volume of your ventilator alarm, going from 1 to 10. Again, you can close any screen by hitting the X at the top left-hand corner of the box. In the Systems tab, at the top you'll find your nebulizer section. This is where you'll be able to put in your settings for your nebulizer. You can toggle between pneumatic or aerogen and choose the duration of nebulization, either from 5 to 40 minutes or toggling on continuous. And then synchronization, only on inspiration, only on expiration, and inspiration and expiration. In the gas source section, this is where you would configure the ventilator for heliox delivery. Going up here, info will give you the software version of your ventilator. Test and calibration will allow you to see all of the calibrations and when they were last performed and completed. Sensors on off. This is where you would toggle on either your carbon dioxide sensor or your O2 sensor. Day-night mode is where you can configure the brightness of your screen. By simply pressing the night mode, the screen dims, offering less patient stimulation at night. And by clicking day, the screen brightens. In the events section, this is where you'll get anything that is done to the vent, including alarm silences, FiO2 boosts, or manual breaths, as well as alarm parameter changes and setting changes. The alarm section gives you your alarm history, and the all events section gives you all alarms and setting changes. In the tools section, this is where you'll find your inspiratory hold and your expiratory hold, along with a unique Hamilton feature called PV tool, which is where it allows the clinician to give the patient a very slow flow inflation up to a peak pressure, and then a very slow flow deflation to a minimal pressure, giving an accurate picture of the lungs, allowing you to set PEEP and an overdistension pressure. In the graphics tab, you'll find that you can choose between 3 different types of graphic layouts. Layout 1 being all scalar waveforms. Layout 2 being what we've seen, half scalar, half boxes. And layout 3 being all boxes. Each one of these boxes can also be configured to show whatever you want, including scalar waveforms. This is also where you'll find your pressure volume loops or any other loop that you would like to see on your patient. Also in the graphics tab, this will show you your trending. We trend all values that are monitored by the Hamilton G5 up to 4 days, anywhere from 1 hour to 4 days. And you can also change your time scale on your scalar waveforms. Monitoring tab, this gives us all the values that are monitored by the Hamilton G5 and its proximal flow sensor. There are 2 pages. If carbon dioxide monitoring were active, it would be these 2 columns right here. If there's any one of these columns that you would like to see at all times, you can use the arrows here to scroll through those columns, leaving any one that you want up permanently. Up here is your measured parameters. We can configure them to whatever parameters you most normally use to monitor. I would like to bring your attention to these tiny numbers here to the left of your main monitor parameters. And those are your alarm limits. So you actually don't have to go into the alarms tab to see what your limits are. They are printed right here on the left. I'm going to talk a little bit about our dynamic lung. Dynamic lung is a unique feature to Hamilton ventilators. As you can see now, the box is highlighted green. Your lungs are full and round. Your bronchial tree is nice and soft and pink, as well as you have your airway resistance and static compliance quantified numerically at the bottom of the screen. This graphic does go off of ideal body weight. So if your ideal body weight is incorrect, then this will be an incorrect representation of your patient's pulmonary mechanics. If your pulmonary mechanics were to change, the graphic will change. It takes about 8 to 10 breaths. That is because the ventilator wants to show you a steady state. So if the patient were to cough or transiently bite down on the endotracheal tube, your graphic would not change. But if your patient were to develop a large mucus plug and resistance were to increase, then first you would see the increase in the airway resistance down here. Then you would notice your bronchial tree start to darken, turn a darker pink, and then finally a deep crimson red, letting you know that there's a severe obstructive component going on, just like that. If your patient's compliance were to decrease, there are 3 different severity levels. The first one being a 6-cornered lung. That represents a mild decrease in compliance. When your lungs turn boxy, have sharp corners, it will always represent a decrease in compliance. Five-cornered lung being a moderate decrease in compliance. And finally, a 4-cornered lung being a severe decrease in compliance. This graphic does not show which lung has had a decrease in compliance, just that there has been a decrease in compliance. It just adds to situational awareness. Over here we have our vent status screen. And what this does is we've compiled 6 criteria that are commonly listed as being monitored in terms of assessing patient liberation from the ventilator. They're FiO2, PEEP, minute volume, inspiratory pressure, rapid shallow breathing index, and percent of spontaneous effort. The floaters all represent what the patient is actively doing right now. When all of the floaters or flying saucers get in the white area, which represents the weaning and extubation criteria configured per facility standards, then this box will turn light green and a big green clock will pop up telling you how long the patient has met their weaning and extubation criteria. IntelliCuff is a unique feature to Hamilton Medical, which allows the user to maintain and monitor your cuff pressure. You'll find in the IntelliCuff port, you will hook in your IntelliCuff tubing, filter line at the port, there. And then you can access IntelliCuff on your user interface by hitting the IntelliCuff tab, and that will bring up your IntelliCuff menu. When IntelliCuff is in the off position, it simply monitors cuff pressure. By hitting manual, you can actually set the cuff pressure that you would like it to maintain. Right now I have it set at 25, so we'll leave it there. If there was an increase in airway pressure, then IntelliCuff would sense an increase in pressure and withdraw volume from the cuff. If the patient suffers a decrease in pressure, if they get diuresed or get turned so that a giant leak would appear, it would measure a decrease in pressure and withdraw volume from the cuff. You can also extubate and check for leaks around your cuff by hitting the deflate button. You tap the deflate button, it says, do you really want to deflate the cuff? Say yes, and it withdraws all of the volume out of the cuff. Takes about 3 seconds, and then you can withdraw the tube. To reinflate the cuff, you would just hit manual, and it will put air back into the cuff. Going down, looking at our soft keys. Alarm silence gives you silence for 2 minutes. FiO2 boost, 100% button. The O2 house will give you 100% oxygen or FiO2 for 2 minutes. It will also kill all of your alarms for 1 minute. So please be cognizant if you do leave the bed space and this is active. Your patient doesn't have any active alarms. The third thing that this does is if this is active, it incorporates an anti-spew mechanism where flow is taken off and no PEEP showers occur. To take it out of that, you would just reconnect the patient and ventilation would resume. You can also turn off the FiO2 boost whenever you want. Screen lock button toggles on and off. When it is on, you can not use the screen. Lung button is your manual breath button. If for any point you need to give a manual breath, this will give a manual breath at the settings that you have set. If you hold it down, it will not perform an inspiratory hold. It will simply give the breath with the eye time that you have set. Nebulizer button toggles on and off. When it's toggled on, it will deliver a nebulizer treatment to the patient per the settings that we discussed earlier on in the film. It toggles on and off. If you notice that your nebulizer is finished before it actually toggles off, you can toggle it off here. Over here you have your file print button. If you have a compact flash drive plugged into your ventilator or a USB stick, then you can press this button and take screenshots of your user interface and transport them to a computer or other device in the form of a JPEG file. And finally, down here, we have your standby button. Press it once, it will bring up a confirmation screen to actually place the patient standby. You'll need to activate standby, and the vent will go into standby. Thank you so much for listening. I hope it's been informative and fun. And that's it.